Well, as we told you, September is National Suicide Prevention Month, and statistics show millions of people struggle with thoughts of suicide.
Now, there is help, not only for those struggling, but for their friends and family members. So what should you look out for in others, and how can you take steps to help yourself? We've got Carrie Mull. She's with Trinity Health joining us this morning. She's got some answers for us. Carrie, thanks so much for being here.
Yeah, thank you so much for having me.
Let's start with the statistics. You know, obviously, mental health is a huge concern, and suicide goes along with that.
Yeah, and actually those statistics, as alarming as they are pretty underreported, which is not great.
Right.
And the prevalence and the statistics are trending in the wrong direction, which is pretty unique to mental health. You know, you hear about other illnesses, stroke, cardiovascular issues, and we seem to be making good progress. With mental illness and suicide, we're not heading in the right direction, which is not acceptable.
Yeah, it's something that maybe a lot of people didn't know. That some of these diseases, as you mentioned, heart disease, cancer, they're going down, but not suicide. When it comes to this, what should people be looking for? I know this is something that we cover often, but it's something that bears repeating. If you're around someone who may be considering this, what does that look like?
Yeah, so there's certain risk factors and there's also warning signs. So it's really great to know the warning signs and then know what to do about them when you see them. So risk factors are individuals that might be experiencing depression or having a hard time sleeping or substance use disorder, right? Or experiencing traumatic events. And then the warning signs would be isolation. So individuals that are very used to being social and hanging out with friends and family, and now all of a sudden they're isolating. Loneliness and feelings of hopelessness are big, huge red flags. So when people feel hopeless, like things are just not getting better, and even saying things like that, making statements, expressing feelings of hopelessness, and feeling like a burden to their family, combine those two with access to lethal means, so access to a gun or access to pills or whatever, and that is kind of the trifecta of the warning signs. So then we need to do something about that.
Okay, so then what do you do?
Yeah, and that's a good question, because I think that people don't know what to do, so then we avoid talking about it. And it just promotes the stigma, right? So that's the opposite of what we should do. We need to talk more about suicide, more about depression. So first notice the warning signs, and then ask the question. Do not be afraid to ask the question. Like, come right out and say it. Are you having feelings of wanting to hurt yourself? Are you having feelings of wanting to die by suicide? I mean, people don't talk like that. So then, you know, it feels like we're embarrassed and we have this judgment about that. That is not what we should do. So ask the question first and foremost.
If that is something, a very good point, if it's something that is difficult to do, some people, you mentioned the isolation, some people who isolate don't want people to talk to them, okay? They just don't want any connection. Are there other ways to get other resources to get that information from them if they're just not open to talking?
Yeah, I think that that's a bit of a myth, honestly.
Okay.
I think that people do want people to talk to them. And I think that people do want people to listen with empathy, not with judgment. So often we say things like, well, you're not really thinking about doing something stupid, right? Now, of course we wouldn't want to talk to someone with that kind of comment, right? So when we listen with empathy and not judgment, I think people do want to be sought out. And I think asking the question, like, are you feeling like you might want to hurt yourself, saves lives. But we have to know what to do then when someone says, yeah, yeah, I am. And so often we're like, please, please don't say yes, because I don't know what to do.
Right.
But we do have resources. There's tons of resources. First of all, we have 988, right, which is very similar to 911, and that's intentional. So we can dial 988 anytime we want to get connected to a mental health professional. You can also text the word home to 741-741 if you want to text with a mental health professional. You can check out the trinityhealthmichigan.org website. There's a plethora of resources on the website. And then we have the Behavioral Health Crisis Center. which is located on the Trinity Health Grand Rapids campus. It's open 24 hours a day, 7 days a week, no matter your insurance. So there are resources. So we don't have to hold our breath when we ask the question and say, oh no, please don't say yes, because now we know how to connect people to resources, which is key.
And I'm glad that you mentioned the insurance part too, because a lot of people, when they're going through that, also think about, well, what about the cost of doing, that it can be another deterrent.
Right.
Yeah. So if someone does say yes, that's where you want to direct them. And someone who, a loved one, is able to call and use these services and maybe get some help to be able to talk it out with this person.
Absolutely.
Yeah.
Yes, connecting to mental health professionals is critical.
Okay. Is there anything else you think we need to know?
I think just leaving this discussion with 3 takeaways. Okay. Notice the warning signs. So now we know some of the warning signs, so notice the warning signs. Don't be afraid to ask the question, and then connect to resources.
Absolutely. See the signs, know them, talk about them. I love that you said that we don't talk like that. Maybe we should start talking like that more.
Yes.
Get that information, call 988 or text HOME to 741-741 if you or someone you know needs help. Or as always, visit trinityhealthmi.org/behavioral health and you'll get everything you need for behavioral or mental health services and resources. We'll be right back.